So, good afternoon, everybody. Thank you very much for coming in early. So, DAPM RV Dental College and Dayananda Sagar College of Dental Sciences, Bangalore, in association with Indian Academy of Oral Medicine and Radiology, Karnataka State Branch, are very happy to offer this webinar, which is so very topical career opportunities for dentists and oral medicine experts. It is indeed a very important webinar of which we are also a part of. Thank you very much for your confidence in us. Thank you, IAOMR. Here, Group Pharmaceuticals, of course, always believes that healthy smiles matter. If you look at this picture, immediately we see this missing tooth in the smile. But what we sometimes miss is this missing eyebrow. So what it indicates is the smile is such an important aspect, and the creator of the smile, maintainer of the smile, and the person who brings the confident smile to the patients is of course the dentist who uses this dental chair for his art, skill, and science. So salute to all the dentists who are now reflecting on a very important aspect of what is trending in careers. When we say career, the foundation of life, Confucius, one of the important Eastern philosophers, said, choose a job you love and you will never have to work a day in your life. Now, is that possible? Yes, it is possible if you have all these characteristics. If you want to become a very successful careerist, build a very good occupation, one requires the character. Character is the mental and moral qualities which are distinctive to an individual, such as integrity, honesty, courage. So these are very important traits that are required for a good career. Competence, the ability to do something successfully or efficiently, is of course the foundation of your career. Commitment, the state or quality of being dedicated to a cause, activity, is called as being committed to the job or to that vocation. And when you are fearless, that is confident, there is a belief and a faith that you have faith to do some particular thing, makes you a very successful careerist. Communication is critical in communication of career aspects. The imparting or exchanging of information by speaking, writing, or some other medium, including delivering speeches, customer communication, very important when it comes to career growth. And if you are a very creative individual, then imagine you are able to use your ideas to create something. That inventiveness, it makes you very. So, with these important C's, you also need to be a very connected person in today's world. Yes, of course, social media is going to help you get connections, but that connection is very important for you to become a successful careerist. So, whether it is a job interview or whether you want to build an employment of your own, that is self employment, your character, competence, commitment, confidence, creativity, communication, and connectedness. All these make you a very successful careerist. So, when we say a person wants to get onto a career point of view, it may be employment where you are a regular employee, or it could be employment where you are an intrapreneur. You are using the employment platform to do something very enterprising, or it could be a startup, a self employment, or entrepreneurship. These are the three broad vocations which are available to all careerists. But when we embark on the career, we should be very careful not to get burnt out. This career burnout is also an important situation which may happen to individuals. For example, I recollect I came across an orthopedician who, just due to the severe, intense practice he had done for about 1.5 decades, he got burnt out and he stopped practicing even though he was a talented orthopedician. So these are some situations which are caused due to the mental, physical, and emotional exhaustion due to prolonged and excessive stress. It can make a person hopeless or even resentful. So career involves being involved in a very positive manner. So the purpose of Group Pharma, which is to provide customers with excellent oral and healthcare products such as Densive, which is truly good for clean and aseptic dentures with a product patent technology, We have also launched 10 first time in India products, Acclaim, Cheyenne, Shy XT, and so on. We are a 43-year-old young company in transformation medicine. We basically collaborate with various universities and we work for translation or transformation medicine to ensure that commercialization of various ideas and concepts that have taken genesis in universities are brought to the market. So this is how we got our entire range of products and we continue to upgrade them. For example, the Cheyenne has now become SLS and parabens free. The University of Florida has given us the bioactive glass technology, the brand name being Cheyenne. Imperial College London has given us the fluoridated bioactive glass toothpaste technology. In fact, the entire Biominef is also manufactured here at Malur, which RV Dental College people had visited recently and conducted a dental camp. Thank you. And Columbia University gave us the technology for a botanical oral rinse, Ora Life. And JSS is another academy with which we are working on various evidence-based experimentation and new product concepts. So essentially, our products are through translation medicine. So IAOMR, Indian Academy of Oral Medicine and Radiology, started in 1985, has been focusing on developing higher standards in teaching and practice of oral medicine and associated aspects, and also continues to promote continuing education. And we have today RV Dental College, formerly known as DA Pandu Memorial RV Dental College, which is a part of RV Educational Institutions, which was founded way back in 1940 by Shivananda Sharma and Kasturi Rangashetty. And notable personalities, including our own international cricketer Anil Kumble, then Miss India supranational, that is Asha Bhatt, South Indian film artist Lakshmi Gopal Swami, many others are there as alumnus of Rashtriya Shikshana Samiti. And in 1992, the DAPM RV Dental College was established and is located in one of the good areas of Bangalore and enjoys very high rating among all the dental colleges. Similarly, Dayananda Sagar College of Dental Sciences is also a very well-known institution in Karnataka and in India. Many students have gone out of this college to have a flourishing career in their life. So there is a world-class facility and a good student population. So this ensures that there is excellent one-to-one communication with the staff. There is extensive preclinical departments as well as good tutorial facilities at Dayanand Sagar Dental College. So we observe that these two colleges and IOMR Karnataka have come together and launched today's very important dentist webinar. Now I'll ask just 3 questions, quiz time. I'm watching the chat section also. People who answer first, right? So we are going to ask questions. Those who answer first, we are going to give them a prize. So let's see who are going to answer. So fastest finger first. I'm watching the chat section. Kindly type your answer there. The first question is coming. And the question is a little tough one. Any idea what is Holland code career test? Please type the answer if you know. What is Holland code career test? Since today it is on career, dentist careers, I have put this question. If you have any answer, please type in the chat box. I'm watching the chat box. What is Holland code career test? It is a very tough question. Holland code career test. I'll wait for 5 or 10 more seconds and then I'll pass it and I'll go to the next question. To assess if a career suits, yes, Revan Joshi sir, we give you that. So the first answer comes from Revan Joshi sir to assess if the career is correct for us. Exactly. The Holland code is also known as the RIASEC. So once you take that test, the participant, after answering the questions, he will be classified as either he is realistic, artistic, social, investigative, conventional, or enterprising type of a person. So here we observe, for example, this Holland code result says for some individual, RIA, realistic, investigative, and artistic. So based on this traits, that individual can choose a career pathway. That is the idea. So if you get a chance to do the whole and code career test, please do it. You will get into a very good journey for your own. Now, the next question, this is a sitter. Please comment on the thickness of enamel in diabetics. You can type on the chat box, please. I'm looking for the answer. Please type in the chat box. Comment on the thickness of the enamel in diabetics. Please give some remark. Yes, please. I'll wait for 5 seconds, then I'll proceed to the next one. If you know the answer, thinner. Okay. Revan Joshi sir, again, you are showing as usual, very smart, Dr. A has also given a right comment, reduced. Thank you very much. Yes, you can expect hypoplasia, reduced micro hardness, and decreased thickness of the enamel. So basically, we have a toothpaste called Acclaim, which gives the nanohydroxyapatite, and that will help in strengthening the enamel. Last question. Let us see if you get this. Last question, please. Who is Lester Burkett? Can you please write who is Lester Burkett? Please type the answer. Who is Lester Burkett? The person who gets the right answer, father of oral medicine. Yes, accepted. Divya has got it right. So, congratulations, Divya. So, Revan Joshi sir and Dr. A, they got it right for the second question. Revan Joshi sir got the first question right, and Divya has got the third question right. So I'm giving prizes only for these people, not all the people, because it is first fastest finger first. But in the case of Dr. A, who was very close, along with Dr. Revan Joshi, we are giving it to him. So please email your name, address with PIN code and mobile number to this email ID, Sunil Chiplunkar at grouppharma.in, and we will send you the gift hamper. So please, I'm repeating, winners, that is Dr. Revan Joshi sir, Dr. A, and Divya. Please send your name, address with PIN code and mobile number to Sunil Chiplunkar at grouppharma.in. So thank you very much for participating in this quiz and in the onboarding. Now it is over to the team from IAOMR. So I request the team from IAOMR to take over. Thank you very much. Good afternoon, Dr. Sumanth sir.
Good afternoon.
Good afternoon, sir. I request Sunil sir to kindly enable Prashanth sir as a presenter.
Dr. Hemant sir is also online, sir. We have to make him a presenter too.
Dr. Hemant sir and Dr. Prashanth sir, you can make them as presenters. Thank you, Sunil sir, for such a wonderful introduction for us to start today's session. A very warm welcome to all the delegates for today's webinar. The Department of Oral Medicine and Radiology, DAPM RV Dental College and Hospital, and Dayananda Sagar College of Dental Sciences, in association with Indian Academy of Oral Medicine and Radiology, Karnataka State Branch, welcomes all the dignitaries and delegates for today's webinar. The webinar is on career opportunities for dentists and oral medicine specialists by Dr. Sumanth Nagraj to commemorate the Indian Academy of Oral Medicine and Radiology Day. We acknowledge the presence of our beloved principals, Dr. Prashanth S, Principal and Principal of DAPM RV Dental College. Sir, would you like to talk a few words?
Hello.
Sir?
Thank you, Dr. Shriyanka. I wish that the program all the success.
Thank you so much, sir. I now request Dr. Hemant, sir, Principal, Dayananda Sagar College of Dental Sciences.
A very good afternoon to one. Thank you for inviting. I wish you all the best success for this program and to Dr. Suman. Thank you.
Thank you, sir. Now I request our beloved former principal, Dr. K.S. Nagesh, Professor, Department of Oral Medicine and Radiology, DAPM Dental College and Hospital, to deliver the preamble for today's webinar. Over to you, sir. Nagesh, sir.
Good afternoon. Thank you very much for inviting me for this webinar. And first of all, I welcome Dr. Sumanth Nagraj.
Thank you,
for
sir.
this program. He has agreed to give the talk. We have a distinct advantage of our subject, oral medicine and radiology, today being celebrated as a National OMR Day. We are part of the medicine. So we are also part of the general medicine and radiology as a part of the general radiology. I think this is the only branch of dentistry where extensively we are associated with general medicine, general radiology, and the recent advances in the field of radiology like PET scans, MRI, CT scan, everything. So for a long time, the dentists were only confined to the practice or to a job in an institution or an organization or a government service. But now the horizon has widened. So it has ample of opportunities in the field of research, because earlier all research were just a mono research, that is single specialty research or single basic science research like physics, mathematics, or chemistry. But the world has now changed. We have moved from mono research to multi-research trials, multi-translational research, interdisciplinary research. So this has opened up a wide opportunities for the dentists, especially oral medicine and radiology people. I'm sure that Dr. Nagraj, who is very well versed in this field and who is working for one of the premier institutions, he'll be able to throw more light on that. I'm sure that this webinar at least will kindle some sort of an interest among the youngsters. I heard from Dr. Joshi, nearly about 60 undergraduate students have joined, and many young postgraduate students in the field of oral medicine and radiology. They can make a career in the field of research, and someday they come out with some of the world-class research programs and initiatives, bringing our branch and also dentistry to a higher level. Once again, I thank the organizers for giving this opportunity, and I look forward to hear from Dr. Sumanth Nagraj. I am sure that it will be very interesting to all of us. Thank you very much, Dr. Chiplunkar. Thank you for sponsoring this program. You are always with us, and certainly we will work together to make our profession a much better place among the medical professions and the medical team. Thank you very much.
Thank you so much, sir. It gives me immense pleasure to introduce the guest speaker for today's session, Dr. Sumanth Nagraj. As I introduce sir today, we may feel that sky is the limit for achieving. Sir is currently the senior researcher at Magic Evidence Ecosystem Foundation, Oslo, Norway. Previously, sir has worked as a clinical lecturer in Peninsula Dental School, University of Plymouth. He was an adjunct professor at Manipal University, College of Malaysia, and also a research fellow at University College, Malaysia. He has been awarded as an honorary research associate at University of College of London, UK. He was heading the Faculty of Dentistry at Manipal University, Malaysia. He was the assistant professor at Misrata University, Libya. Sir was previously the professor and head, Manipal College of Dental Sciences, Mangalore. Sir has completed BDS from Kuvempu University and MDS from Bapuji College of Dental Sciences, Science Evidence-Based Healthcare at University College of London, UK. Sir is currently involved in various research projects. He's also involved in systematic review, including Cochrane and non-Cochrane methods. Sir was being awarded as the best outgoing student for the subject of oral medicine and radiology from Bapuji Dental College and Hospital, Davangere. Sir was one of the youngest guest speaker at Indian National Oral Medicine and Radiology Conference held at 2011. He was the first Indian and second Asian to be in the Cochrane Oral Health editorial team. Sir has numerous publications and has authored various books. He is also a peer reviewer for more than 15 journals related to oral medicine, oral pathology, and radiology. With the above background, now I request Dr. Sumanth Nagraj to kindly take over the session. Over to you, sir.
Thank you. Thank you for those kind words. Can you see my slides?
Yes, sir.
Okay, great. Thank you for giving me this opportunity to join you all on this commemoration ceremony of IAOMR Day. They actually invited me to talk on 24th April, but my schedule was a bit tight on 24th April, and so I agreed for this talk on this particular day. Thank you for that. Just to begin with, I don't have any financial or non-financial interest to disclose regarding this particular webinar. And I neither dissuade individuals for pursuing dentistry, nor do I advocate for dentists to migrate from India or select alternative vocations. Right. These are the news reports. These are the headlines some of you might have come across in the newspapers or in the websites, which might be quite alarming. You might feel that, am I in a wrong field? Why did I choose dentistry? Is my future in dark? All these questions might come to you or your parents. So at least once in your dentistry career, you would have thought about this. But dear friends, I'm here to assure you that if you can excel in the field of dentistry, if you can gain adequate knowledge and skills in the field of dentistry, as just now somebody mentioned, sky is the limit. So you need not worry about this career. You need not repent for choosing this career. And I'm very proud to have been choosing this dentistry as my career. And today, wherever I am, whatever I am doing, that is because of the dentistry field and my specialty, oral medicine and radiology field. Right. The first question, what are the career options of an Indian dental graduate? This is the question everybody in your family, every friends group will be asking you. So I would like to share 3 stories here, and these 3 stories will lead to my additional slides in this presentation. So what are these 3 stories? These 3 stories are about 3 people whom I know. The first one, Brian, was my student in Malaysia. Second one, Shashank, is my student in India. And Mona is my PhD supervisor in UK. I'm going to share a few interesting things about these 3 people. Brian did BDS from our Manipal Institute in Malaysia, and right now he's working as a training and education manager for Malaysia and Singapore at Straumann Group. He's also doing part-time dentistry, practicing part-time dentistry. Plus, the interesting fact is he worked as a model for U-Mobile, Baskin-Robbins, Old Town Coffee, and he was Mr. Popular in Manhunt, Malaysia, and Uberman competitions. So presently, Brian is balancing his professional life and personal life by doing part-time dentistry and his core interest in modeling and his core interest in marketing. So all these things, he is doing a perfect balance. The second story is about Dr. Shashank Bhatia, who owns a multi-speciality clinic in Surat. He was conducting all these days some courses across India for young dentists to learn some new skills. He is also training new dental graduate for Australian dental exams. Currently, he is migrating to Australia, and Shashank's motto in life is augmenting career in dentistry. So he is planning to build his career in dentistry with additional skills, additional features to augment his career. The third person or the third story I wanted to share was my supervisor, Professor Dr. Mona Nasser. If you look at the achievements, if you look at the qualifications Dr. Mona has done, it's amazing. She is a dentist from Iran. She is also an epidemiologist working in Plymouth Dental School. She's a director of Plymouth Institute of Health and Care Research. She's a licensed pilot. She has done MSc in astrophysics. And if you see this photograph, you will be amazed. She is also a licensed or a permitted or a certified skydiver who enjoys doing mathematic puzzles on her hand while diving. She's also working with the School of Engineering with postgraduates, and she's now currently working on a robot which is trying to assess the anxiety among dentists when they are doing the dental treatment. And this interests, all these varying interests, all these varying careers has really astonished me. And her motto in life is research as a common element to cruise the world of science. So, my dear colleagues, you have heard these three stories. All these three people are dentists, but they have not sidelined their personal interests. They have augmented their career. They wanted to achieve something in their life and they are working for that. So, as a dental student or as a dental graduate, you might have optimistic view about dentistry or you might have a pessimistic view about this field. But in today's presentation, I'm going to suggest few career options for you, which if you're optimistic, will be happy to choose. If you're pessimistic, you need to decide what you have to do. I have broadly classified the career option for you as dental practice, abroad opportunities, dental entrepreneur, and healthcare services. So let us start with the first, which we all are intending to do, that's the dental practice. So the first thing comes to our mind when we aim at dental practice is, I have always been to be a dentist. Is this in your mind? I'm made for this field. Are you thinking that you're made for dentistry? I love to drill and fill. Is it so? My handwork is good. Are you? So if you have answered yes for all these questions, yes, definitely you should be in the field of dental practice. Then comes the next question. Should I pursue MDS? There is no dearth of MDS seats today in India. You have to get the NEET qualification. Then you have to choose an appropriate branch. But here comes the biggest question. Many people are confused. They check the market value, they check how much money they can make with that particular branch, and then they start choosing that particular branch. My dear friends, your skills, your interest may not lie in that particular master's course. If so, then please don't choose that just because that particular field has got highest market value or you can make more money in that field. Somebody said that this is a field where you can earn money. Choose a specialty which is close to your heart and always give importance to the branch over the college. Don't lose a branch or don't lose a specialty just because it is offered in a college which is very famous or has got a 5-star rating. Suppose you think that you cannot pursue MDS and your option is to start your own dental practice. You need to think some positives and some negatives about starting this practice before you start that. Supporting factors for starting your own practice. Yes, you are your own boss. You are not answerable to anybody. You have to invest your time, money, and heart, and this will definitely not disappoint you. And if you do a quality work, your work will speak, your work will act as an advertisement for your clinic. And if you practice ethical and healthy practice, then there is long-term benefit in your clinical life. Of course, there are some detracting factors. It's a heavily competitive field, especially in the urban India. Waiting period to build client pool is a bit annoying. There are ups and downs in the income generation. patients are bargaining, there is unhealthy competition. You need to think over all these factors and then take a decision. Once you chose that you want to start a practice, then comes the question, what type of practice should I opt? Are you going to practice in an urban center or in a rural area? Are you interested in a general practice, or you want to limit yourself to a specialty practice? Do you want to invest heavily and start a 5-star clinic, or you want to just run a family mediocre clinic? Do you want group practice along with your peers, or do you want to do a solitary practice? Once you have answered all these questions, you know where you are leading, so you can opt for this. Second comes the abroad opportunities. There are some countries which are in need of dentists and specialists in dentistry. So you need to think, or you need to get information. How do you qualify, or how do you enter those countries and practice dentistry? I'll just start with Malaysia, where I was previously working. Malaysia has got 13 dental schools, and there is dearth of teaching faculty in Malaysia. So they are always recruiting people from India in the teaching institutions. The scope for academic jobs is based on either your BDS degree is recognized by Malaysian Dental Council, or if it is not recognized, then what you should do. If your degree is recognized by Malaysian Dental Council, any of the MDS specialties, you can go to Malaysia and join as a lecturer. But you need to have 5 years of dental practice experience. That means after BDS, you need to have 5 years of experience. If your BDS is not recognized by a Malaysian Dental Council, still you can go, but you need 5 years post MDS experience to join any of these Malaysian dental colleges. Both the cases, you need to give a professional qualifying exam, which has got 3 parts: theory, practical, and clinical. And these 3 parts of exams you need to pass to get a temporary practicing certificate, and then you are entitled to work in Malaysia. You can always choose a teaching job, and you can shift to Malaysia, and there once you join, you can start giving your PQE exams, and you have to pass the exams to continue your work in Malaysia. The second option, which we all have heard about, is Middle Eastern countries or the Gulf countries. Majority of these Gulf countries are having licensing exams, which are comparatively easier. For example, Dental Health Authority of Dubai or Qatar Council of Healthcare Practitioners, they are having specific websites and they are conducting these exams. And there are options for doing online exams also. I have given some web links here. You need to have 3 to 5 years of clinical experience. Either you can choose Prometric, which is a global organization for conducting online exams, or you can go to individual country data site and get the information about these exams. I have given 2 examples here. For UAE and Qatar, it's usually 150 MCQ questions, and heavy weightage is given to restorative, oral medicine, and oral surgery. And you need to get 60% overall, and you need to get 60% individually for restorative group of questions and oral medicine and oral surgery group of questions. And you have to submit all your documents to data flow group, that is your educational qualifications, dental council registration, if there are any experience certificates, everything you need to submit and then get the approval for appearing for this particular exam. Here, I would suggest a point. When you are collecting your experience certificates, whether it is a private clinic or a dental institution, please make sure add a sentence telling that how many hours of clinical practice, individual practice, not assisting or not helping a student, how many patients individually you have treated or how many hours you have spent treating individually, because many of these countries need hours of clinical practice as a basic requirement. Next, coming to United Kingdom. United Kingdom, you have got 2 exams. One is ORE, that is Overseas Registration Exam, or you can take licensing in dental practice, that is LDS exams. Any one you can choose. Both are equally good. Both are almost similar, but it's up to you which one you want to choose. The first one, Overseas Registration Exam or ORE. For this exam, once you pass this exam, you can be registered under General Dental Council. And this tests or ORE exam tests your clinical skills and the knowledge, especially from people from outside the European Union. Otherwise, European Union people are eligible to practice in UK. And there is no distinction or rank in this exam. You just need to be passed in ORE exam. So how does ORE function? It has got two parts, part one and part two. Part one has got a theoretical component, that is part A in part one is about basic sciences, and part B is clinical dentistry, law and ethics, health and safety. This is again an MCQ exam. It's a 3-hour paper. And once you pass this, you are eligible to appear for part two. Part two has got 4 parts. First one is 3 preclinical procedures on mannequins. Then you will have OSCEs, that is objective structured clinical exams. Then you have a long case where you have to do a diagnostic and treatment planning exercise, which is very well taught in oral medicine postings. And lastly, you have to perform a practical exam in medical emergencies, that is the BLS on a mannequin, and you have to answer some questions. Coming to once you pass the ORE, then you have to do 1-year vocational training in order to work for NHS. And this is a bit dicey situation. 1-year vocational training has to be done in United Kingdom under a licensed dental surgeon. So many people get cheated here because of this particular clause. Some people they open bogus dental clinics in the website and offer such vocational training, and people from India, I know many people who have been cheated like this. So be careful. If you are opting for 1-year vocational training, make sure the papers are right. Whoever is inviting you has got a genuine purpose of training you. From year January 2025, UK government has reduced the fee of part one. Of course, they have increased the fee of part two, but this is to encourage people to take ORE part one so that people really are interested to go to the part two. And there is no exemption for ORE. You have to pass ORE to practice in United Kingdom. Just because you have done MFDS or any other Royal College fellowship, you are not exempted from the ORE examination. The second exam in United Kingdom is a license in dental surgery. It's known as LDS. So again, LDS has got 3 parts. I have put the latest fee available for year 2024 for each of these parts. In this first box, I have mentioned the syllabus for the license in dental surgery exam. If you carefully notice the syllabus, there is a heavy weightage given to the professionalism, interpersonal communication, and social skills. In fact, I can say almost 40% weightage is given for professionalism, ethics, communication skills. So you need to understand the General Dental Council principles. What are the ethics related to the dental practice? What are the different methods of communication? As far as my training was concerned during VDS or MDS days, we had little weightage for professionalism, interpersonal communication, and social skills. I'm not aware about today's teaching process in India, but this is how it is evaluated in LDS exams. So if you are really planning to take up these exams, make sure you go through the literature or the recent text related to these particular areas. In part one, again, you have part A and part B. Part A is more the basic dental sciences, and part B about the clinical dentistry, law and ethics, and health and safety. You need to pass part one to proceed to the part two. Then in part two, you have OSCE, 12 stations, 7 minutes for each station, and there will be an unseen case. You need not worry about this terminology. It just means there will be a case history given to you, as you get a case history or a patient in oral medicine postings, and you need to go through the history, you need to achieve a diagnosis, you need to give the treatment plan, and time is given for you to think over this, what investigations you want to do, and there will be a sort of minimum viva for this. And the part 3 is again held for a period of 1 day, and it has got a sort of a preclinical section that is 180-minute. You have to do some exercises on a dental mannequin. Usually it will be a cavity cutting, crown preparation, or variations in these methods. Of course, there won't be any preclinical extractions or any such procedures. A lot of importance is given to the restorative activities. Let's go to United States of America. United States of America, as you all are aware, you have to clear the NBD exams, and then you will be eligible or qualified to join a dental school, and you have to pursue the course of dentistry for 2 years. Just by passing the exam, you are not qualified to practice in US, but you are allowed to join a dentistry course, and the course duration is shortened for you. I have contacted one of my colleague who was working with us, who's a prosthodontist and now working as a dental practitioner in Canada. I have asked him to share his experience for this purpose of talk. Sorry.
Hi, I'm Abhishek. I'm presently working in Malaysia as a lecturer since 4 years and presently working towards moving to US or Canada. One of the prime reasons I would say is for further education. And I'll also say that it is because of the constant motivation which I got from my friends who are working in US. And they say that obviously the salaries are good, but the working hours are very flexible and I can lead a very comfortable lifestyle. The suggestion to whoever is planning to move to US or Canada, I would say that first of all, they should have a lot of patience because it's going to require a lot of steps and it will take some time. If you start thinking now, then it will take 2 years from now to actually go there. So in the process, I think we should improve our resume by enhancing our skills and knowledge by attending certified hands-on courses or workshops, and also conducting some research activities. And in the end, I would say that whoever is planning to go there, I think you have to be totally determined to achieve your goal. Otherwise, it's not worth it because a huge financial investment is needed in this. And in the end, I would say that best of luck for whoever is chasing this dream.
Yeah, that's Abhishek. He has already joined Canada as a general dental practitioner in Ontario. So these are the steps. If you are interested in joining a dental school in USA, this is what you need to do. I have described this in a step-based manner. Once you clear this, then you will get an invitation for attending an interview from any of the dental schools, and you need to give a sort of interview why you are interested in pursuing dentistry there. And once you have cleared, then you have to get 2 years of dental school training to be a licensed dental practitioners in USA. And once you get this qualification, you are entitled to practice even in Canada. Similarly, if you directly want to work in Canada, I have given you the workflow in this slide. So this is the pathway for working in Canada. You have to go in these stepwise manner. You have to first submit your certificates in the NDEB website, and you have to get the attestations. Then you have to join any of the dental schools, which is quite competitive. And then please remember, Canada, there is a problem with joining the dental schools. You need to be a permanent resident. If without permanent residency, if you opt for a dentistry course in Canada, then after finishing the course, you need to be back. So without having a PR in hand, it's not very good to opt for a dental program in Canada. Coming to Australia and New Zealand, lot of scope is there in these two particular countries because of the shortage of dentists. Again, one of my friends who migrated to Australia and he's working as a dentist has established a very good clinic in Sydney. I asked him to share his experience and he's willingly sharing his experience. He's Dr. Kedar Kulkarni. Hi, I'm Dr. Kedar from Sydney, Australia. I've been working here in a private setup for the past 3 years. I graduated from India in the year 1999 and went on to complete my post graduation 3 years later. I worked for nearly 10 years in India, after which I decided to move to Australia. The whole process took me nearly 2 years, which is generally the case. The process can be divided into two parts. The first part involves clearing the exams and getting yourself registered as a dentist in Australia. The second part is, of course, getting a proper visa. These are two distinct processes. However, clearing the exams and getting a registration does help in applying for a visa. Coming to the examination part, the process is clear and simple, and all the information is available on the internet. It involves three parts. The first step is getting your documents assessed, and if necessary, you need to sit for an English test or a language test, such as the IELTS. The second step is the written exam, followed by the last step, that is the clinical exam. All the necessary information and study material is freely available on the internet. I got a lot of help from Facebook communities as well as Yahoo groups. And if you know someone who has recently cleared the exams, it does help as you get first-hand information about the whole scenario. The most important thing to remember here is that unless you have a proper visa, it is difficult to secure a job or enjoy the benefits that Australia has to offer. I hope this piece of information was helpful. Cheers. Yeah, that was Dr. Kedar Kulkarni. So for the Australian exams, as Kedar suggested, you need to clear your IELTS, then you have to have a minimum score of 7. The second box, I have described you the various papers or the components of papers. You have 4 papers, and there are 3 assessments. One is initial assessment, second one written examination, and third one the practical examination. The details are given here, and the web link is also given at the bottom. You need to visit these websites, and you need to understand the whole process of how qualifying dental examination is done for Australian practice. Then comes the Scandinavian countries. Almost all the Scandinavian countries have a similar process. I have given an example of Norway because I'm working in Norway and I have understood the situation. Whether it is Norway, whether it is Sweden, whether it is Finland or Denmark, you need to learn their language, and their qualifying examinations are held in their languages. It is not held in English. So if you are really interested to move to these countries, you need to first learn the language and you need to be expert in that language so that you can understand the examination questions. If you have this aptitude, then you need to submit your degree certificates and transcripts for the evaluation, and you have to submit your curriculum. They are very much particular about this curriculum. Please collect the curriculum from the Dental Council of India website. Also, your institution where you are doing your BDS, make sure the document mentions how many hours of posting you did in preventive and community dentistry, because all these countries give heavy weightage for preventive dentistries. They are not interested in how many extractions you did. They are more interested in how many cases did you do topical fluoride application, how many oral health programs did you attend, or how many PRRs you have done in your practice. That is what they give a lot of importance. I know people from India who have applied and their applications got rejected just because the curriculum or document what they submitted, it did not show the preventive dentistry aspects. So if you are really aiming for these countries, get the documents ready highlighting the preventive dentistry and the community dentistry areas where you are being trained. Um, Once you submit the documents, you need to pay a fee. Then the processing time is quite lengthy. It's almost 11 months because the situation of the dentistry, how it works in these countries is a bit slow. And of course, you have to learn the Norwegian language if you are planning in Norway. You have to give both theory and practical exams. And once you have cleared the exam, you need to be under supervised practice. The advantage of working in these countries are like once you clear the practicing exam, then if you are a specialist in India, still you can register as a specialist in Norway without giving any specialty exam. The third option mentioned in my talk was dental entrepreneur. If you really think that you have the skill of entrepreneurship or you are interested in this particular area, this field needs entrepreneurs. There is shortage of dental entrepreneurs. So what you need to you can think is in two areas. One is establishing a dental lab, and second one you can become a dealer of dental materials. Both the areas, definitely there is a lot of demand. When it comes to dental lab, there are a lot of opportunities. There is good market. There is no dearth in manpower. Companies like Sirona are offering training for such people who are interested in dental lab. There are some challenges like you don't get a degree or you don't get a course in this. There is huge investment in the initial period, and once you train people under you, they can leave you easily and they can join another company or another lab. So high staff attrition rate is a bigger problem in dental lab. I have shared here the photograph of Dr. Vijay Sima, who was my student in Mangalore, who has established a lab in Vijayawada and also is running a dental clinic. He was trained by Sirona. Similarly, I came across this Denta cart in the website. This is something like your Flipkart, which is giving you all the dental materials. I'm not sure how efficiently this works, but this was one idea which I really liked. So if you have such innovative ideas, you can think and hone your entrepreneurship skills. Then comes the health services sector. Health services sector and humanitarian sector is always short of qualified people. So there are abundant opportunities in health service sector. I'm sharing here one of my students' experience, Dr. Dipin Gupta. He was our MCOTS Mangalore student, and he was also a TMFI gold medal winner in the dentistry. And presently he is working for as a project lead in WHO team in Norway.
Hi everyone, my name is Dipin. Post BDS, I joined the humanitarian sector simply because I believe it's a very meaningful work to do. During the initial stages, I found it difficult to catch up with my peers in terms of technical knowledge, especially for subjects like finance and economics. However, in retrospect, I believe that learning the non-dental subjects for the first time was much more easier than learning the dental subjects for the first time. So in case you're planning to make the change, I recommend that you think really, really hard about your reasons to do so. Because see, there will always be a mental baggage about making a change in your career. And that mental baggage, on one hand, will motivate you to work harder, but on the other hand, it will also make you desperate for success. And that desperation is, I believe, the biggest negative about changing the fields. On the positive side, it's a very thrilling experience. You will learn new things, do new things, and in the process, you may end up finding the work that you want to do for the rest of your life. So think really hard about your reasons to do so and analyze whether they are really sustainable in the long run or not. Good luck. Take care.
I have also shared another of my student, Dr. Manish Jain, who was a prosthodontist, who did MBA, and right now he's working as a senior manager for Philips Imaging Systems in Rajasthan.
My name is Manish Jain, and I am an alum from the class of 2005 at MCOTS Bangalore. Presently, I'm working with Philips Health Tech as a senior manager, and I handle the imaging systems portfolio for Rajasthan in India. My career post dentistry has been a bag of mixed fruits, some sweet and some sour. The reason for moving out of dentistry was the usual confusion that all of us face during the earlier stages of our career. Once my heart was set outside of dentistry, I believed that a career in business management would be the logical next step. However, it was easier said than done. With a lot of stress on business intelligence, market analytics, and strategic thinking, it sure shook me out of my comfort zone. However, I believe that the effort has been worthwhile. The healthcare industry is poised to grow immensely in the years to come. So my advice to all of you listening to this video is listen to your heart. It surely knows what you want. Should you have any questions related to a movement in the world of business, feel free to reach out via LinkedIn or Facebook. I look forward to seeing you sometime. Cheers, guys.
This is another of my student, Dr. Nisha Bimsaria, who was a BDS graduate from Manipal College, Mangalore. Later, she developed interest in health service sector. Now she is a NABH consultant in Noida, Uttar Pradesh. She helps a lot of hospitals to get the accreditation from NABH. These are some of the career options for you if you are not interested in pursuing a dental practice. There are so many other options, and I have listed them here. You can become a biostatistician, or you can learn big data analysis, or enter the field of AI through machine learning. You can learn epidemiology, or you can become even you can graduate in the law and become a consumer court consultant. During my career as a researcher in the European Union, what I have understood is there is acute shortage of biostatisticians and health economists. If you think that you have a love for mathematics, you love the numbers, then please do think that whether is there any career option for you in biostatistics. Are you interested to do that? If you love the field of economics, there is acute shortage of health economics specialists in the research projects. We give a lot of advertisements to recruit a health economist, and we don't get easily. And even if we get, people are willing to only work with us only for few hours, and they charge heavily. So these are something what we are seeing. And if a BDS graduate can become a health economist or a biostatistician, it will be double advantage for us, because they understand the clinical perspective. They are also subject experts who can help us in research. I'm sharing the one of my friends' experience here. This is Dr. Pramod, who did BDS from Davangere, MDS he did from Russia. He's now working as a senior clinical trial analyst in Indigene Life Systems, Bangalore. He has totally quit dentistry because of his interest for this particular analyst field, and now he is happy with this particular field. Now, regarding the oral medicine radiology specialists, whenever I meet young postgraduates in the conference, people come and do ask me about the career options. And I decided whatever I know about this options, I will list it here during this presentation. If you have done your master's in oral medicine and oral radiology, you can always choose to establish oral medicine, oral radiology practice, or you can enter your general dental practice. Some people just opt to be in the teaching profession. And recently, there is a special field known as special care dentistry, and US and Australia are offering master's program in this. You can get this done and you can become a special care dentist in this in practicing in India, or you can move abroad with this particular master's. Now, coming to research career, um, I'm so happy with the field of oral medicine because it equips you with both dental and medical knowledge. My dear colleagues, I'm working with so many medical specialists in my projects. Right now, I'm working with some of the nutritionists, some of the pediatricians from Africa. I'm also working for internal medicine people and geriatrics specialists in Europe. And always during the meetings, when I say that I'm a dentist, they look puzzled. They ask me, you are a dentist, then how come you know all these things? That's the time I have to explain what is my specialty. I'm from the field of oral medicine and radiology. I'm well versed with the medical knowledge, and it links the dentistry and the medicine field. That's the reason I'm at ease whenever I participate in their meetings. I can easily understand what they are talking. I can easily comment for the discussions. And as a OMR specialist, you are trained in the field of immunology, genetics. So you can always further pursue your career interest in these two areas because there is shortage in immunology and the field of genetics. In the conferences, I have seen people are coming up with innovative ideas of formulations, new pharmaceutical molecules, using herbal molecules and adapting them to the oral environment. People are interested in this type of innovations, so please pursue that. There is a lot of demand for such innovations. If you are interested in clinical trials, definitely Western world is looking at India for collaborative centers to start with clinical trials. So you can set up a clinical trial center and you can always recruit patients. You can help in conducting the clinical trials in the field of dentistry. Artificial intelligence and data science is another booming field. There is a lot of demand for this particular two areas. So again, if you are interested in programming, if you are interested in numbers, please think about these two fields. Now, coming to oral medicine and oral radiology as a specialty practice, yes, you can always become a specialist and you can start your specialty practice. And there are numerous examples who are doing well in this particular area. I have chosen few of my own friends or students to share their experiences here. First one, Dr. Suhas. Dr. Suhas is an oral medicine specialist, and he has started his oral medicine, exclusive oral medicine clinic, Samhita, in Bangalore, and he is doing well and he is happy with this practice. Similarly, one of my students, Dr. Srinivas, he's an oral medicine and oral radiology consultant in Manipal Hospital. He does exclusive oral medicine and oral radiology practice. This is my friend Dr. Sham, who has started a CBCT center in Mangalore. He's not doing general dentistry, he's exclusively doing oral radiology work. Similarly, this is one of my students, Dr. Nimesh Jain, who has started a web space for teledentistry in Indore. And he does a lot of CBCT trainings, he does a lot of reportings of CBCT scans. And I'm also a consultant in this web space. You can acquire additional qualifications to enhance your skills. People usually ask about the Royal College's fellowships and diplomas. Yes, they are one way of enhancing your skills. If you are a BDS graduate, you can choose for MJDF, that is a Joint Dental Faculty Specialist Training. If you are a MDS graduate, you can always go for fellowship in dental surgery by the Royal College of Surgeon, or FDS RCS Ireland or Edinburgh or Glasgow. Or if you are interested in general dental practice, you can go for FGDP. People are interested in pursuing masters in United Kingdom. If that is your ambition, then please look at these scholarships which are available for master students from India. Commonwealth or Chevening scholarships are really good scholarships if you are trying to pursue masters in United Kingdom. You can also register for scholarship alerts. There are many alerts that can come to your inbox. Please use any of these or Facebook groups. If you are interested in these groups, you can go there, have a look what are the recent scholarships that are being announced. Even scholarships for PhD, open calls for PhD and postdoc positions will be there in these websites and in these groups. Then comes your skill enhancement. What is taught in your BDS is not sufficient to really practice dentistry. BDS gives you only a basic knowledge. You need to have some advanced skills to be established as a good dentist. So think about taking some opportunities to learn or enhance your skills in implants, aesthetic dentistry, or facial aesthetics, microscopic endodontics, lasers, forensics, CBCT, and even TMD. There are many courses I see in the websites, especially running in India, so you can choose the best one and you can enhance your skills. Recently, I came across an article which was talking about the bridging course of BDS and MBBS. I'm not sure whether it has started, but the article, what I quote in the bottom, they have conducted a survey among dental graduates and they have asked, is it wise to go for a bridging course after doing BDS to MBBS? And the survey results mention that they are very positive. So many of the dental graduates are keen to get into this bridging course. If you feel that you are not happy with the field of dentistry, you want to change your career, Dental Council of India has given this option according to the website information. I'm not sure about this information, whether it is right or wrong, please check. But this looks like a good option. And when I was invited to give this talk, Dr. Asha specifically mentioned to me that I need to talk about my career journey also in this webinar. So I have kept that as a last option. I have traveled through the globe and I have worked in many places. I have divided my career as my job history and my collaborative projects. I started my career as a lecturer in India. I worked in northern parts of India, southern parts of India. Then I migrated to Libya, where I worked for a year in a university. Then I shifted to Malaysia, where I worked for 12 years in a Manipal Dental School. And later I shifted to Norway, where I'm working as a senior researcher. At present, I'm also handling another job that is in Peninsula Dental School, University of Plymouth, where I work for 2 days. I teach research methodologies, and I am also senior researcher for the Norwegian group, where I have got an opportunity to work with different research groups across the globe. Right now, I'm working in a lot of collaborative projects which extend from McMaster University, Canada, Chile, South Africa, Nigeria, Malawi, China, European Union, and Korea. So all these collaborative projects are not, none of these collaborative projects are related to the field of dentistry. Everything is related to the field of medicine. As I mentioned, because of my training in the oral medicine subject and oral radiology subject, it has become very much easy for me to gel with these research groups and to work with them cordially. My dear colleagues, you know yourself, you know your strengths, you know your weaknesses, you know what is that you crave for. So please find that passion, because finding your passion is the key to your success. And once you understand your passion, choose that and choose what is best for you. Those who are really confused about their career options, as Dr. Sunil mentioned in the beginning of this lecture, there are websites where it tells you, do you suit for this particular profession? I'm also giving you a link to the toolkit. This is known as career planning toolkit. You can use your hand phone cameras and click this. This will take you to a London school website where they have given a career planning toolkit. There are some questions you need to answer these questions, so it will help you to clearly see what exactly are you aiming as a career in your life. So if you have taken the picture or if you have accessed this website, I'll go to the next slide. I would like to acknowledge all my friends and my students who have given me a lot of inputs to prepare these slides. I really thank them. Some of them have shared their photographs, their experiences. I want to thank Dr. Seema Patil, Dr. Asha Iyengar, and Professor Dr. Nagesh for inviting me for this lecture. The managements of DAPM, RV Dental College, and Dayananda Sagar College of Dental Sciences, Karnataka State IAOMR branch, and Dr. Sunil from Group Pharmaceuticals. Thank you very much. And if you want to connect to me to have any sort of discussions, research collaborations, you can use this QR code or you can email me. Thank you very much for your patience listening. And if there are any questions, I'm ready to take it now. Thank you.
Thank you so much, sir. We are thankful for the opportunity to hear your expertise on this topic. Sir, there's one question from Dr. Samadrita Paul. She's asking, is there any qualifying exam for teaching profession in Malaysia?
Whether you want to work as a lecturer or you want to pursue any master's course in Malaysia, both the situations you need to have a qualifying exam, that is professional qualifying exam. So you need to clear that, then only you can enter Malaysia. Even if you clear that PQE exam, you are not entitled to do private practice or join any private practice in Malaysia. That's only for teaching opportunities or doing some master's course or PhD course.
Thank you, sir. Participants, if there are any queries, you can put it in the chat box. So if you get any future queries, we'll just post it to your email address. Will that be fine, sir?
Sure, I'm happy to answer.
Thank you so much, sir. I will kindly present you the e-certificate. Sunil, sir, can you present the e-certificate to sir?
Thank you.
Thank you so much, sir, for your time and your expertise in all that. Now I request Dr. Asha Iyengar, ma'am, President, IAOMR Karnataka State Branch, to talk a few words. Ma'am. Asha, ma'am.
Thank you, Dr. Shriyanka. First of all, on behalf of the Karnataka branch of Indian Academy of Oral Medicine and Radiology, I'd like to thank Dr. Sumanth. When I met him in Davangere last December, I was very keen that he should speak to our students, and you know, his career trajectory has been so wide and spread out. I thought it will, his knowledge and experiences will definitely be beneficial for all our students to listen to. So I'm glad that he could make time from his busy schedule and address the students. He's done a very exhaustive homework for this and managed to rope in so many of his contacts, and I think give a very vast picture of what is the worldwide global scenario, options you can have. So I think the students will no longer have to feel that they don't have minimum options. They have a lot of options. It's just that they need to decide what they want to do and what they really like. I'm glad that the DAPM RV Dental College and Dayananda Sagar today could host this program along with the support of Group Pharmaceuticals. Dentistry isn't the best phase. I do tell my students or anybody who talks to us, now it's like so much more advances because of the technology and disruptive technology which has come in. So I'm sure the students are much more tech savvy than what we were. So they can really apply their minds and their brains to do so much more than just basic dentistry. That's how it is in the engineering field and other fields where, people don't start off with what their basic training has been. They do branch off. And that's what I think the biggest example is Dr. Sumanth, because he has started his career as a faculty. He has been international faculty and now he's into research. So it is such a wonderful to see such super achiever amongst us, and to know that you can really do pursue what your passion is, no matter where you start off from. So I think this lecture has been really very, I'm sure, an eye-opener for a lot of people, and also a lot of information has been given. I'm sure the students will take a little while to digest whatever information is there, and probably they'll have a lot of questions. So maybe if through the organizers and through your contact, if you could help them out, because definitely as they move ahead, they will have a lot of more queries and a lot of more doubts. And I'm sure with so much of so many people and people like you who are willing to help, and I'm sure they will find it a little more easier to move ahead in their career path and to move ahead in their decisions. So once again, thanks, Dr. Sumanth. Thanks for accepting this invitation and talking to everyone. Over to you, Shriyanka.
Thank you so much, ma'am. As we come to the end of today's program, I thank Dr. Sumanth Nagraj, sir, who from his busy schedule agreed and conducted this webinar in a very elaborative way. Thank you so much, sir. I also thank Dr. Nagesh, sir, Dr. Asha, ma'am, Dr. Hemant, sir, Dr. Ramnarayan, sir, and Dr. Seema Patil, ma'am, for the continuous support in conduct of such high impact programs. Not last but not the least, I'd like to thank Dr. Sunil Chiplunkar, sir, Vice President, Group Pharmaceuticals, for the continuous and constant support in smooth conduct of this program and all our future programs. Thank you, sir. Thank you all the delegates for your patient hearing. Thank you so much. Any queries, please post into oralmedicine.rbdc@rvi.edu.in. I'm posting it in the chat box. We'll forward it to sir, and then we get back the answers to you. Thank you so much.
Thank you very much. So with due respects, I'll be closing the webinar. Is it okay?
Yes, sir.
Yeah, thank you. Thank you very much. Congratulations. Awesome.
I request the participants to kindly fill the Google Forms, which was provided in the chat box, so that the e-certificates will be provided to you people.